Okay, Dr. James is here with us, and we are going to talk about viral infection versus bacterial infection. Now, guilty. I'm like, just call in the Z-Pack because in my feeling, I think, if I just have a Z-Pack, then I'm just going to be better.
Right.
I may or may not need it, but it could be a placebo. Who knows?
Absolutely.
But in my mind, I'm thinking that I know what I'm talking about. Clearly, I don't.
So let's clarify. We get called all the time about sinus infections, sinusitis. And the studies have shown, and this is from the American Academy of Family Physicians, that antibiotics do not decrease the duration of sinus infection. So Z-Pack or no Z-Pack, you're going to get better in 7 to 10 days.
So what's the deal? Why take a Z-Pack?
You should.
Really?
So the only time you take antibiotics if your sinus infection has lingered for more than 10 days and you have just terrible pressure, you're actually getting fevers at this point, and we need to go ahead and clear out those maxillary and frontal sinuses with an antibiotic. Same goes with what we call upper respiratory infections. Everyone thinks you need a Z-Pack. Well, 90% of upper respiratory infections are viral. So only 10% of the time do we actually need to use an antibiotic.
So, and the antibiotic, it messes with the immune system, right?
Well, it kills bacteria.
Or the good bacteria.
It can kill your good bacteria as well, so it can mess with your GI tract. And if you use antibiotics when you don't need to, you can breed resistant strains. That's why it's really important, if you have a cough, sinus congestion, runny nose, to call your doctor and let them figure out if it's viral or bacterial. And if it's viral, do not demand antibiotics because in the long run, you're actually going to be harming yourself.
Really? What about steroids? Like sometimes they'll say, well, let's just do some steroids instead.
Now, I am a proponent of a steroid injection or a steroid dose pack, no more than once a quarter. So you shouldn't be doing it every other week.
But if a patient has someone like you in their life, managing their medical needs and prescriptions, as the doctor, you would know that, okay, well, hold on, we did this a couple of months ago.
Exactly. We need to wait.
We need to wait rather than going to an urgent care facility at different places
You're going to keep getting steroid shots.
Right.
Well, yeah, because steroids are great because they reduce inflammation. So if you've got a sore throat, even if it's viral and you're feeling terrible, I will give a steroid shot to give you that boost and to get you over the hump. But you cannot give steroid shots or do dose packs every week. That is not good for you and will hurt you in the long term as well.
Wow. Thank you for these tips, Dr. James. Visit Dr. James at Diamond Healthcare. DiamondPhysicians.com, sorry. DiamondPhysicians.com. And you can get more healthy tips and know that Z-Pack isn't always the best way to go.
Isn't always the answer.
No.
Antibiotics are not always the answer.
No.